Pain in the testicles, or what some guys call pain in the balls, can range from mildly annoying to downright alarming. But what causes it? Is it always serious? And when should you be worried? If you're over 50 and noticing discomfort down there, this video is for you. Welcome back to the channel. I'm Dr. Zoe Hartley, and here we talk honestly about men's health after 50. Whether your testicle pain is sharp, dull, or random, you deserve answers without embarrassment. Let's break down what's happening and what to do about it. 1. Epididymitis, infection of the sperm tube. Most common cause of testicle pain in adult men. Often caused by bacteria from a urinary tract infection or, in some cases, an STD. Symptoms: swelling in one testicle, pain that worsens when standing, fever or painful urination. Treated with antibiotics, don't delay. 2. Testicular torsion, twisting of the sperm cord. Rare but serious and urgent. Sudden severe pain in one testicle. Swelling, high-riding testicle, nausea. Emergency. Go to the ER. Can lead to permanent damage if untreated within 6 hours. 3. Prostatitis or pelvic nerve pain. Pain might not come from the testicles directly. Inflamed prostate or pelvic nerves can refer pain to the scrotum. Symptoms: deep ache between anus and testicles. Trouble urinating. Pain during ejaculation. 4. Hernia, inguinal hernia. Occurs when tissue pushes through your groin muscles. Can cause aching or sharp testicle pain. Worse when lifting or coughing. Treatable with surgery. See a doctor if bulge or pain appears. 5. Varicocele, enlarged veins in the scrotum. Feels like a bag of worms above the testicle. Dull ache, especially when standing. May affect fertility but often harmless. Relieved with scrotal support or surgery if needed. 6. Testicular cancer, rare but serious. Usually painless, but some men feel pressure, discomfort, or a lump. Self-exam once a month is key. Early detection equals very high survival rates. 7. Referred pain from kidney stones or back issues. Pain in the testicles can come from kidney stones, infections, or herniated discs. Especially if pain moves or shoots into the lower abdomen or groin. Don't ignore testicle pain if you notice. Sudden sharp pain. Swelling or redness. Pain with fever or nausea. A lump or size change. Pain that lasts more than a few days. Your body is trying to tell you something. Listen to it early and avoid bigger problems later. Pain in your testicles might be embarrassing to talk about, but it's more common than you think. Whether it's an infection, nerve issue, or something more serious, you owe it to yourself to get it checked. Like this video if you learned something new. Subscribe for weekly health tips made for men over 50. And don't miss my next video. What age do boys start getting pubic hair? A surprisingly common concern.